Hi, I'm Johnny Cassanci. I am a licensed educator in 3 states. I am a licensed clinical therapist or a licensed professional counselor in 2 states. I'm also a national certified counselor. I am a personal trainer through the National Academy of Sports Medicine, and I am also a nutrition coach with Precision Nutrition. I have been working in the fields of education and mental health care, as well as fitness and nutrition for over 22 years combined. I have a lot of experience. Most of my experience has been with adolescents. Most of my experience has been in high schools. I am kind of uniquely positioned to be able to talk to you today about integrated healthcare and the intersection between education. So this will be the first video, the first introduction video to what I do. So afterwards, I will give you some contact information. If you want to get a hold of me and reach out to me, I would love to speak to you as an educator, as a counselor, and or as admin or as the supervisory staff with school district. So what I want to first talk about is what integrated healthcare is and what it's not. So I'm going to start with what it's not, because usually we get a little confused about some of these terms. So what it's not really holistic care. Holistic medicine takes us into the realm of like naturopathy and non-traditional healthcare techniques, and that's not what this is. It's also not behavioral coaching or parenting classes. I mean, that can be a component of it, but that's not what integrated healthcare is specifically, especially as it relates to education in schools. So what is it? Well, integrated healthcare means that your primary care physician, your psychiatrist, your clinical therapist, your social worker, and in the case of school-based counseling, guidance counselors, teachers, administration, any stakeholders, it could even be religious people who are involved in the child's life or family members. It's any stakeholder that has interest in the student or the child. And so when we talk about integrated healthcare, we talk about sharing medical records back and forth. We talk about being invested and involved in talking to primary care physicians and psychiatrists about medication management, talking to clinical therapists about, boots on ground, talking to kids and talk therapy and all of the other modalities that we use. So that's really where the intersection between mental health and education and therapists coming into the schools is really vital and important, because we come to, when you integrate into the school with that model, you're integrating not just the clinical therapist or the social worker that's working with the child in therapy, you are also integrating all of those stakeholders into the mix and making sure that everybody's on the same page. Nobody's out of the loop, and the child and the family are getting the best care necessary. Now, why in schools? Well, because for a long time, we were either going to home visits, which a lot of therapists don't really do anymore, or we were having families bring their child to a facility where they would then have to sit around and wait, and it wasn't really convenient. And there are a lot of families who, either financially or transportation-wise or for whatever reason, just can't bring the child to regular therapy sessions. And so it's a limiting factor. So a while back, I don't know the date specifically, but a while back, Medicaid and state-sponsored programs for medical care started to provide for mental health care within the schools. And so they were embedding mental health counselors and social workers into the schools. But this was only accessible for the students who had state-sponsored health care. So fast forward to this year, and Deer Valley Unified School District, which is who my business, Southwest Behavioral Health, contracts with in order to have us in the school, has done something kind of unique. They have put forth for half of the contract for us to be in schools. So the 5 high schools in Deer Valley Unified each have a wellness counselor that is on site during the school day every single day. Now, with the epidemic going on right now, where we've all moved to telehealth, and that's a completely different video that I'm excited to share with you, because I have been doing telemed for years now. When I was living in Missouri, we had a lot of rural clients who, in the wintertime especially, there would be weather conditions that they couldn't make it to physical counseling, and so we would have to make do with phone visits and things like that. It was a little bit before the video chatting. But the epidemic has actually done something really amazing for mental health care that I think is going to turn integrated healthcare and education on its head and allow for many more people to have access to the types of care that they need to have. And I'm very excited about that. So even though it's a very scary time for many of us, and there's so many unknowns, there's some exciting things happening in the healthcare world and in the world of education that I want to share with you. And so I'll have some future videos for teachers and counselors and administration and for other stakeholders that really target some information that you need to know about how we're going to be using technology moving forward. I also taught online classes, and I've been in technology and education for a long time as well. So I have an especially unique situation where I can help bridge that gap for teachers and counselors and parents and students, and again, all the other stakeholders that are involved in this, and kind of trying to figure out what's going on, because a lot of people are kind of freaking out a little bit over the use of this. They're not used to the technology and so on and so forth. So moving forward, the best advice that I can give to you right now about this integrated healthcare model and what we're doing in the schools is the outreach part of things. And that's another thing that I'll talk about in a later time, is how do we get those referrals, and how do we really move forward in making sure that everyone who needs to have healthcare gets that healthcare. And how do we make sure as well that all of our students and families that need access to technology perhaps, or who have a need for special needs, are also getting that care as well. So I look forward to future videos with all of you. If you want to get a hold of me in between now and then and schedule either a live chat, we can't really do conferencing face-to-face, but I can certainly do video conferencing with schools and educators and people to talk about this. And this is moving forward. I mean, this is just, for me, it is again, it's kind of a scary time right now, but it's also an exciting time for us that we get to utilize this technology in new ways to really bring this integrated healthcare together. Because like right now, I'm doing a video. I could be doing a video chat with a primary care physician. I could be utilizing those other things. There are some limitations to it too. We have HIPAA laws in the medical field that limit some of the confidentiality, so that's been kind of a learning curve. We also have FERPA laws in the schools, which are also confidentiality with students and their privacy. And so we're still navigating some of that as we go, but the school state boards and the mental health boards and agencies and school districts are really moving forward in quick ways in order to remedy those issues. So with that said, I'm going to turn this video off, and then I'm going to plan some new videos as well. If you would like to get a hold of me in the interim, my email address is jonnikat, it's JONNIKHAT @gmail.com. You can also reach me on Facebook at Jonnikat Sanchi. I have all of my contact information all over YouTube on my channel. I have links to my blog, so you can definitely get a hold of me. I would be more than happy to reach out and talk to people and try to help people navigate, because this, again, can be such an exciting opportunity for us to really reach out and reach more families, more kids, and help even staff and other stakeholders get the self-care that they need as well. And those will be other videos too. So I'm really excited to bring more content to you. So thank you for listening. And I know you heard my dog trotting around in the background here. Yet another piece of us having a learning curve of being at home and not having professional technology that we can put together these videos. But hopefully, you know, moving forward, maybe we will. Thank you for listening again, and I'll catch you on the flip side.